Hi, I'm TM Powell with 44 in the Town, and we're at Bright Eyes in Tampa, and I'm here with Dr. Benea Warford, or as he likes to call himself, Dr. Nate. Now tell us about this facility here that's really geared towards children in optometry.
We've had a practice in the West Chase area for about 8 years. That seeks to provide care for the entire family, so from infants all the way up to grandparents and great-grandparents. We wanted to expand that children's care, and so now we have an office called Bright Eyes Kids, and we focus just on children at this office.
And, in my investigation, you said that you were seeing about 50% kids.
Mm-hmm.
You were seeing adults at the old location, but you were seeing 50% kids, so you thought, why not just build a whole facility just for kids?
Yeah, exactly. The main reason is we really find that we provide the best care for kids when the entire office is geared specifically for them. Everything from the waiting area to where they check in to the exam room, everything is designed to make them feel comfortable and make them feel relaxed. And that really does allow us to get the best clinical data for our decision making.
And your background is in optometry, correct? Where'd you go to school at?
I went to school at the Illinois College of Optometry after my 5 years at University of Florida. And I did my residency in pediatric care at the Illinois College of Optometry in Chicago as well.
Now, I'm a father myself. I have 2 kids. I know what it's like taking them to the doctors.
Right.
They're scared. Even I can get a little nervous about going to the doctor
Absolutely.
sometimes. We're all human. But you do a lot of things here to make it inviting for the children. Tell us about that.
Well, you're exactly right. And a lot of times, both kids and adults don't think of medical visits as a fun place that they'd like to go to, but we've worked really hard to make this as enjoyable for kids as possible. We have a Thomas the Train table out front and a Lego table where the kids can build and relax. Once we are in the exam room, we use lots of toys, we use lots of games. We try to make it as fun as possible for them so that they don't get nervous, so that we can really work with them and get a lot of great information so that they don't mind coming back.
Yeah, because kids, unfortunately, they're not always honest. They don't mean to be, but they're
Right.
not always honest.
Right.
So it's a better gauge to get what you want if they're comfortable.
Well, absolutely. And when we're working with kids, we always have to work with 2 different types of information. One is what they tell us, and another one is what we get when we take measurements without them having to say anything. And we always have to balance both those things to get the best information possible.
Now, it's not just about just straight optometry coming in and getting your glasses. You also do visual training here. Explain to people what is visual training who are not familiar with it.
Visual training or vision therapy is helping people use their visual skills to do the things they want. For children, that's usually if they're having trouble either reading or writing, either because they're getting headaches or they're getting discomfort or having double vision or something like that, and it makes it harder for them to get their homework done. It makes them harder to take the standardized tests that they have to take these days. So we work with them, we give them specific activities that teach them to develop those skills so that they have a lot more control over it. And that helps not only them in the short term, but it helps keep their eyes working well as they get older and they do whatever job or selection that they wind up doing. They're obviously going to be reading and writing and using computers, so we want them to be as productive as possible with their vision.
Give us some examples of some of the exercises you may do, because I've seen the rooms, I've seen, there's hula hoops, there's flashcards, there's all different types of things. Give us
Right.
some examples of what you can do in visual therapy.
One of the most basic things is just giving patients feedback about what their eyes are doing because they really have no idea. So we have one instrument, it's called a Brock string named after Dr. Brock, and they hold the string up to their nose and there's beads along the string and it tells them where their eyes are pointing and where their eyes are focused, and most kids had never really thought about that before. So we can use that to give them feedback or information about how their eyes are working, and then we could challenge them to develop those skills better.
Now, I heard a little rumor that you love Lego Mini-Mates, and sometimes you can even have the people bring them in, you'll swap them out. Tell us about
Yeah,
this.
well, that's exactly my patients love Legos. They go to Legoland all the time, and at Legoland you can trade minifigures. And so we started doing that here. As a matter of fact, even today somebody brought a minifigure, and so I have an airplane that's filled with minifigures, and they can bring me one and they can pick one from there, and it's an ever-changing mix of minifigures, and it's just one more way to have fun.
Now we're joined by Dr. Knighton. She's one of the optometrists here at Bright Eyes. Now, Dr. Knighton, if a kid comes in, tell us about the typical visit. What would they expect?
Sure. Well, they can expect at first for us to check and see how well they're seeing, checking the letters on the charts, just like we do with most patients. But then we get into looking at how their eyes are working together, and so we test their vision with a lot of things. But these tests involve looking at pictures of animals and moving their eyes around the room, following fun toys, and so they really feel like they're just playing along with us when really we're gathering a lot of information about how their eyes work together and how their eyes move.
Now, young children, we always take them to the pediatrician, and obviously they do a little bit of eye testing there, just checking out the basics.
Right.
But when should they see their optometrist? When is the first time they should come see an optometrist as a child?
The American Optometric Association recommends that kids have their eyes checked at ages 1, 3, and 5. There's very important visual milestones that they meet at those ages, and it's especially important at that age 5, right before they go into school, that things are looking good for them so they can achieve their success in education.
Well, thank you so much, Dr. Knight, and thank you, Dr. Nate. Thank you so much for having us out here today. Check them out online and come visit them, and if you have kids and they're a little squirmy, maybe they get a little nervous, I have a feeling this may be the place to go.